Hi, Dr. Zoref-Lorenz and Dr. Jordan. Thank you so much for joining me today. I'm very excited to have a conversation with you about your recent participation in the American Society of Hematology conference. I understand it's a really important conference for histiocytosis, and you had a publication there that was related to HLH, inpatient recognition and management of HLH, as well as participated in an education program. So I'm excited to learn more about that. Would you mind both giving an introduction of yourselves and your relationship with the field of histiocytosis? We can start with you, Dr. Zoref-Lorenz.
I'm a physician, a researcher at the Meir Medical Center in Israel, in the Hematology Institute. And my interaction with HLH started 6 years ago when I treated a patient with CLLs that developed HLH. And at that time, nothing was known about adult HLH, but all I read the publication from people in the histio community, and specifically Michael Jordan, that wrote How I Treat HLH in Blood. And after my dear patient died, I decided that I need to investigate this disease. So I contacted Michael Jordan and shared my passion to investigate HLH in adults and in the context of malignancies, and he was more than willing to accept me. And that started our relationship and our mutual research that led me to the point of actually presenting at ASH.
Thank you. Dr. Jordan?
Yeah, and I'm Michael Jordan, and I've been interested in HLH for probably about 25 years. And like Adi, I got interested in HLH because of the sort of amazing but tragic stories of patients that I saw years ago when I was in training. And so I've been investigating HLH. And when Adi reached out to me, my first thought was, well, there's little basis upon which to make any progress, but she's energetic, so why don't we try? In terms of, because this is a really tough area. This idea of HLH occurring in patients with cancer, we didn't, at least we had a genetic sort of leverage to try to begin to unravel HLH that occurs in families, but in the context of cancer, we really don't even have that sort of crack in the wall, so to speak, to kind of work with.
On behalf of the histio community and all the families impacted by HLH and MAS and all of those similar conditions, thank you for your passion and interest in this. And so I understand the American Society of Hematology is important for histiocytosis and specifically for HLH. So how did you participate in the event this year? And if you'd like, you can tell us maybe a little bit more about the publication and education session as well.
Yeah, so I presented an oral presentation about our project for the OMIC project that Mike can tell us some more about, and also a poster and the educational session that's related to the manuscript you mentioned.
But by far the best attended was the educational session. I think is worth pointing out. So it was very obvious that there's a lot of interest in HLH amongst internists treating adults with malignancies and other conditions, and there were, of course, a lot of questions, I would say, at the educational session, and so I think that's in some ways, like Adi mentioned in the review article that I wrote with colleagues quite some years ago now. I think this is the sort of thing that actually does tend to change practice as much as the science, no matter how good the science is.
So I think that what happened in the last years, that the awareness of HLH in adults really increased. And so we had this year 2 educational sessions at the same time. Both I presented an educational session and Ashish Kumar presented an educational session for the pediatric physicians. So I was in a session called The Hematologists as Lifesavers. And my talk was named the Inpatient Recognition and Management of HLH. And I shared the stage with Marty Talman, who was a former ASH president, and Steve Fine that discussed the ITP. Marty Talman discussed the APL. So we it was an interactive session. We went through patient stories, and the audience participated in consulting on this case. And we went through the diagnostic challenge of how do you even recognize HLH from other situations that can appear in the exact same clinical way, but do not involve true hyperinflammation like HLH. And some situation may even be harmed by giving these patients immunosuppression. This was the main focus of Ashish's talk as well. And I've reviewed some of the novel methods for identifying HLH from other non-inflamed situations, some works by Mike and Carl Ellen and Chandra Kassan and Scott Kana. And I also discussed the index we developed, Mike and I, together with collaborators, on how to identify hyperinflammation in malignancy, which is a simple combination of ferritin and soluble CD25 that really expedites the diagnosis. The name is OHI index, the optimized HLH inflammatory index. And we gave emphasis to the point that you have to recognize, to answer the question, will my patient gain from immunosuppressive therapy? And one should ask himself the question at diagnosis, but also throughout therapy, because some of these patients start with classical HLH, but then they can have an infection and deteriorate. And if the physician is not very diligent of the fact that it's not only following some protocol, but actually consider all the complexities around HLH management and different triggers, then he might miss something. And this patient can really get complicated, and that there's very high chances of mortality all throughout HLH spectrum, and especially in the context of malignancy. And there was really a lot of interest in the audience, because I think it's a really unique subject for an educational session. The audience was not used to HLH, unlike other leukemia, lymphoma. So there are a lot of questions from the audience in the session and afterwards about patients that they currently treat or treated before, and people reached out and said, oh, and I realized that I had patients with HLH, but I missed it. I thought it was something else. So giving the stage to HLH, I think really will increase awareness that already increased in the last years.
Wow, yeah, it's very clear to me how important it is, and to be able to make that distinction early on. I know that HLH can become very rapidly progressive, and in adults, I think that is even more challenging, because there could be other complications, other conditions that are overlapping, and also sometimes in adults, maybe a little bit harder to recognize that you're not feeling well, because we're used to sort of self-managing when we don't feel well, and so it might be harder to recognize even within oneself. So thank you for giving HLH that stage and being able to talk about the OHI and how to go about diagnosing. I know that's a really important piece, and so glad to hear there's a lot of interest from your colleagues in wanting to really better understand. That's phenomenal. And it sounds like the publication was related, that it was the inpatient recognition and management of HLH. So was this an expansion on the talk?
Right. It was, and again, it was following the same place and going through the sort of the basic framework on how to approach a patient, the sort of things that you need to address, the novel. It was more focused on papers from the last 5 years, so it was more of updated research tools and everything I've mentioned before. And the emphasis we gave in this paper is that you have to, in the adult population, you always have to consider an underlying lymphoma and actively search for it, to do a PET-CT, to try to take biopsies, and to actively search for infections that may be driving that hyperinflammatory syndrome. And we also focused on current treatment approaches according to the different HLH triggers.
Dr. Jordan, anything you'd like to expand on or add from your participation and experience?
So, I think that we've covered the educational session well. The other thing I think is worth noting is, part of why Adi was invited to give the educational session is because of the sort of scientific work that she's done and that we've worked on over the last few years. And the other thing I think is worth pointing out is that we also presented our work examining, really trying to sort of dissect what's going on in these patients that are, again, typically adults with cancers and that are what we call OHI positive, sort of at diagnosis. And we found, I think, and this is really, I think, profound. We found that these individuals have when we used a new methodology that really hasn't been applied to any form of HLH before, when we do a proteomic study, look at all the different proteins in circulation in the blood, which is, I think, closer to what's actually happening in somebody, with one of these processes. We found sort of an amazing similarity between these patients and very young children with familial HLH, which is in some ways you say, well, these patients, they both look like they have HLH, so there should be some similarity. But we think this runs even deeper, that there are a lot of shared mechanisms. What we don't understand, of course, is how things get triggered to begin with, because in the very young children, we understand that the triggering process or the predisposing process is intrinsically genetic, where it's not so in patients with cancers. But so there's still a lot of work to be done. But I think that this is a really important finding because it suggests immediately a lot of therapeutic strategies that really haven't been applied in these sorts of patients. So I think that it's going to lead to a lot of clinical testing and hopefully clinical improvements in the coming years. So it's very excited for us to be able to sort of present that. It's something we've been working on for a few years now, and we're pulling it together, I think, for a complete story for publication soon. But I think that's a really notable sort of finding, and I just want to point that out that Adi presented that at the meeting in a separate talk.
Really exciting to have that discovery. And then I know that the harmonization of some of the work being done for adult patients and pediatric patients, that sometimes there is this clear separation and other times there is an overlap that can provide a lot of insight and benefit to both. So that's very exciting. And it just shows how far we've come in what we understand, that we can be looking this deep into very specific aspects of the mechanisms and how they might overlap. And so thank you. I'm very excited for the work that you're doing and where this is leading us. Is there anything else that you'd like to share related to either to ASH or anything you'd like to share about how this will benefit the future of treatment diagnostics or anything else for the histio community? I'll kind of leave the last bit up to you where you'd like to take it.
I want to share that I think that a lot of the progress that has been made, that we were able to make in the last several years, was because of this unique partnership. Because I think that I arrived to Mike as a young and a young postdoc, and Mike immediately treated me as a true partner. And I think that he saw the synergism of him being a pediatric HLH expert and I'm being an adult physician that is very passionate to investigate this syndrome. And from the start, we were very devoted to this project, and it helped us made a lot of discoveries. So, and I've just received that. That's also one of the events in ASH that I've received the ASH Global Research Awards to continue to investigate HLH in the context of malignancies, with Mike being my global mentor. And I think that these partnerships in the histio community is what makes it so special and what can help lead it forward and benefit the entire histio community.
That's very exciting. Congratulations also. And I agree. I love that you're partnering, and not only globally, but across demographic and age groups. So that's amazing. Dr. Jordan?
Yes, I think that the other thing I'd add is that the community of physicians focused on histiocytosis it's a small world, right? So for the most part, I'd say we all know each other, and I think that that also really helps. And I think that AD is collaborating with lots of physicians in the broader community now, and has also helped to sort of facilitate community collaborations for both of us. And I think that that's a real strength, that there is this sort of sense of community that we can work together. I think that ultimately there are a few sort of critical steps that need to happen to try to advance things for the patients. And one, of course, is you have to define the problem. You have to understand what the diagnosis is, and that's something that there's more than 25 years of history in the pediatric adult context. In the adult HLH context, I think that's just now happening. And I think that starting with carefully studying the patients clinically, and then carefully studying samples from the patients in the laboratory, and if possible, trying to model what's going on in the patients in the laboratory as well, is really the way forward. So we're sort of turning that corner from, I think there's still work to be done, obviously, to try to really understand and define the problem clinically, but we're getting to the point where we need to begin to define it scientifically. And I think that we're going to see a bunch of potential therapeutics undergoing testing probably by a variety of groups in the very near future. So I think that's exciting. And I think it's really going to change how people think, not just about HLH, but how the immune system works in human beings. So I think that's a really valuable contribution. So I'm very grateful for Adi's energy and interest to collaborate and on our ongoing collaboration. So I think this is something that excites me quite a lot.
Mike, and one last thing to mention is that I also presented important poster, presenting a work of the Adult HLH Working Group of the Histiocyte Society that I'm leading with Gaurav Goyal, that we're collecting cases of patients with malignancy-associated hyperinflammation worldwide to try to identify helpful treatment strategies. And that's another project that could benefit the patients, hopefully sooner than later, before we'll gain all these scientific insights that will allow us to have real rational-based therapy. So this is the first immediate step.
That's incredible. So being able to share sort of best practices in therapeutics, and then advance what scientifically, and then apply additional treatment avenues and things in the future. That's incredible. It gives me so much hope for the patients and families that are impacted by this devastating histiocytic disorder. And it also fills me with so much excitement about where we're going and what we'll know. And to what you mentioned, Dr. Jordan, being able to not only influence HLH, but the immune system as a whole, better understanding, what's going on there, because I know it's a hyperinflammatory situation. And so there's so much to learn. And so these contributions are going to benefit so many people. I'm really grateful to both of you for your passion and interest in this, and for really caring so deeply about each individual patient, but also the community as a whole. And just your work and your dedication to going to events like the American Society of Hematology and presenting your papers and giving these education talks are helping physicians around the world also be able to help others. So thank you so much on behalf of the whole community for what you're doing. And unless there's anything else you'd like to share, we can close here. And I just really appreciate both of you for everything you're doing.
All right. Well, thank you for your interest, Deanna. Really appreciate it.